Cancer will soon become the leading cause of death in the U.S. According to the CDC, cancer death rates are going down, but rates don't tell the whole story. The U.S. population is getting older and growing. More people will be in the age groups most likely to get cancer, so the total number of cancer cases and deaths is getting bigger.
1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer. But despite those huge numbers, most individuals don't know what that really means.
Receiving a diagnosis of cancer can be a frightening thing. The good news is that today is probably the most exciting time in history in terms of the treatment of cancer. Options that didn't exist a few months ago certainly didn't exist a few years ago.
At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost, and particular cells escape the normal control mechanisms, and they continue to grow, and they may spread, that's what we call cancer.
It's important to understand that the cancer that occurs in one individual is very different than the cancer that occurs in another, just like those individuals are different. So a lung tumor in one person will be very different from a lung tumor in another person.
The cancer itself is not homogeneous. There may be 3 or 4 or 5 or 6 different slight variations in the cancer cells that are there.
The best therapies that we can produce really are the result of optimizing the amount of tumor that we can kill by any treatment and minimizing the amount of damage that we cause to the normal cells that would be affected by that treatment.
As the CEO of a cancer center, we are at an amazing time for cancer treatment. There have been 2 major revolutions in cancer therapy in the last decade and a half, and those are precision medicine to target a genetic mutation in the tumor, and immunotherapy to activate the immune system, and that recently was awarded the Nobel Prize, as you know.
The fight against cancer is entering a new and exciting phase. Researchers and doctors are beginning to understand cancer and each individual cancer patient in far greater detail. These advances are enabling a much more personalized approach to cancer treatment. Cancer patients in the future will each experience a different, personalized treatment approach with the promise of significantly improved outcomes.
The overall theme of my lab's research over at Harvard Medical School is to find ways to tap into our body's natural defenses and turn on these genes that exist in our cells, but they typically don't do a very good job. And so we're trying to make medicines that will turn on these pathways, these very ancient pathways, and boost them in a way that will slow down diseases. And when I say diseases, that includes essentially all of the major diseases of Western society, of the developed world. So there's cancer and heart disease, Alzheimer's, osteoporosis, heart disease. And what we're finding in the lab, by tweaking these sirtuin genes and even some of the drugs that we have in clinical trials, they're able to slow down not just one of these diseases, but actually slow down all of them and even reverse some of them.
Cancer Treatment Centers of America has invested in a model in which all of the effects of cancer and its therapy are aggressively treated and managed. It's not just enough to kill the cancer if we don't treat the pain, the fatigue, the depression, or the anxiety that comes with a diagnosis of cancer.
Receiving a diagnosis of cancer can be a frightening thing. The good news is that today is probably the most exciting time in history in terms of the treatment of cancer. Options that didn't exist a few months ago certainly didn't exist a few years ago, like the ability to genomically profile a tumor and to take that individualized fingerprint of that cancer may direct us to tailor treatment in very specific ways.
We believe that in the future, many more patients with a number of different tumor types will potentially be able to benefit from the advances in precision medicine.
There are very hopeful options that are available to us as clinicians to make a difference in patients' lives. And it's therefore just as important for patients to know that so that they have those hopeful options and they take advantage of them.
It fixes everything and makes the whole body more robust and fitter. And that's why we think we're seeing these simultaneous protection against heart disease and cancer and Alzheimer's. And it's not miraculous, it's just a new way of thinking about
Improvements in diagnostic techniques and treatment approaches, the collection and analysis of data from electronic medical health records, and sophisticated clinical decision support software will enable us to create increasingly personalized treatments for cancer patients like Linda. Personalized healthcare will help us to provide the best possible care for each patient. And that is progress in our fight against cancer.